Hansen's disease, we all commonly know it as leprosy, is an infection which is caused by slow-growing bacteria called the Mycobacterium leprae. Now, it can affect the nerves, the skin, eyes, and even lining of the nose. Now, with early diagnosis and treatment, the disease definitely can be cured. But why is this still the topic? Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan and I am going to discuss about how leprosy is still a concern. The old slogan of leprosy elimination as a public health problem is still not complete. However, a new focus on the interruption of transmission has come to light in a recent review in the Indian Journal of Medical Research. It was thought once transmission has stopped, the disease itself will disappear over a period of time, but this may take some years because of the long incubation period of leprosy. New case numbers will decline quickly. So people living with leprosy will have a normal life expectancy. Their needs in terms of managing the leprosy-related disability as well as reducing discrimination will require attention for decades together. So many groups engaged in leprosy work subscribe to a threefold goal of ending transmission, ending the disability, as well as ending the discrimination. So a complementary discussion has been led by WHO to look at indicators and definitions relating to the transmission. The task force on criteria for the elimination of leprosy has produced an interim report and the debate will be taken forward by the Global Leprosy Program of the WHO. So as the case numbers decline, it is becoming more and more feasible to individualize the case management. This will usually mean helping people with leprosy be more aware of their own condition, assess their own status, and also become partners in their own self-care. So support for such schemes through a telephone helpline can be highly beneficial. The research to refine support for self-care practice is still ongoing. So mental well-being is also receiving more attention these days. So the availability of peer counseling within the primary care services is a major advancement, providing reassurance and basic care as well as helping to combat this particular stigma. Referral for specialist care will definitely be needed in some cases. So governments, they all need to commit to training their officials in recognizing these practices and avoid tolerating or even worse, perpetuating them. So there needs to be a clear and a simple pathway for persons affected and their family members to report such an abuse. So the relevant institutions must then act swiftly to intervene, investigate, and guarantee the rights and the dignity of persons who are affected with leprosy as well as their family members. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.